Thank you.
Treatment starts when you talk about your healthcare, when you accept that fact that you are in need for a treatment. So that's where your treatment starts. The other three, which I think Dr. Kumarasamy spoke, was accessibility, availability, affordability. That's the government part. We are going to provide it. That's one of the reasons we are giving this solution also, this particular PrEP solution also for you. So, and all our one-stop solution, stop centers which they are putting up, the VHS is putting up, will also be a NCD screening center. And that's what we are looking at. It's not just about talking about one part of our solution. We are talking just about putting the program or inaugurating the program. It's also important every single student who is sitting here, the MBBS student, the pharma student, the nursing student, would be the messengers for this public health practice which we have started launching today. So that's very important. I think I should thank Madam for it. In fact, I should also thank two of my, I quoted in my opening speech, two P's. In fact, Prepare itself has this two. One is Prabhavati Madam and the other one is Padmavati Madam, who had helped us to launch this program. I think probably when I came for a small inspection 2 weeks back, I came to see this beautiful hall. I was actually surprised that we have a very good hall, and I think we'll also host many of the upcoming programs in this hall. So I thank both of you for making this event happen. What is PrEP? PrEP is not an alternate strategy. That's very important. We always think, I think when they spoke, one or two or three of our people spoke, it's not an alternate strategy. It is one of the strategies within the prevention strategy. That's very important. I think that's the missing gap. What we are doing is the missing gap. When we have a lot of prevention strategies, we have a missing gap. There is I think Melissa, when I spoke to her in Delhi, she talked about the negotiating power. When the people do not have a negotiating power. So what do they do when they don't have a negotiating power? They do have an option now. Earlier they did not have an option. The option is called PrEP. And I think this is the bigger message which we are launching today. We are giving that woman, that lady who doesn't have that negotiating power, an opportunity.
Is finding and fidelity. NACO is keen to replicate the index testing program at national level and will do so soon. To improve access to the treatment, Andhra Pradesh led the way by demonstrating differentiated models of care such as multi-month ART drug dispensation, and this has been adapted by the national program. I would like to thank NACO for their support given to the state, and we implement programs in accordance with the national guidance. Besides, there is close collaboration between National AIDS Control Program and National Viral Hepatitis Control Program. When this invitation was extended for me inaugurating a vital prevention initiative of promoting PrEP, I really accepted. I accepted because this is a very important initiative of reaching out and providing prevention services to the people of Andhra Pradesh. I would like to express here that there is an urgency for us to prevent HIV among the key populations. The health of vulnerable key populations is equally important. I would like to say here that our dynamic Chief Minister, Sri Y.S. Jagan Mohan Reddy Garu, will ensure equitable access to prevention programs to the vulnerable key populations and will leave no one behind in the response. Here, I would like to laud the efforts of voluntary health services who, with support from CDC, have done stellar work in bolstering the prevention efforts, especially among the vulnerable key populations. Their efforts on mainstreaming transgender healthcare in the government health system by establishing one-stop centers at the Government General Hospital is highly appreciable. This is the first time in the country that an initiative at this scale of providing comprehensive care for transgender and other key populations in the government hospitals has been carried out in Andhra Pradesh. I would also like to take a moment to thank CDC, Dr. Melissa and her team for their support to the state in scaling up the HIV response. As a health minister, the vulnerable communities are my biggest priority, not only in HIV but all in health programs. Providing access to quality health care to all, and particularly the poorest of the poor families, is what we strive for, and we are making great progress in the state by achieving universal health coverage. Our Honorable Chief Minister, Sri Y.S. Jagan Mohan Reddy Garu, gives highest priority for the attainment of all the sustainable development goals to achieve the sustainable